It's always nice to know insider information. Having a friend who can tell you the tricks of the trade when starting a new job or doing a home renovation can make a huge difference. Many of us even do this with healthcare, when in need of a new physician or specialist. With so many people having similar experiences, it just makes sense to share the knowledge, which is why Michelle Rapkin was so stunned at the lack of information when she was first diagnosed with non-Hodgkin's lymphoma.
The minute my doctor told me I might have cancer, I went to the bookstore to look for a book to say, like, now what? How do I find an oncologist? What questions do I ask? And there were lots of memoirs and lots of very heavy-duty medical books, but there was nothing that was a step-by-step roadmap and companion.
Rapkin forged her own way through the diagnosis, leaning on friends and her own trial and error until she came out on the other side victorious.
I had surgery, chemo, and went into remission for 16 years. I thought I was healed. Everybody did. And then I had other strange symptoms, not symptoms of lymphoma, 16 years later in 2017 of January. I had moved, so I had new doctors. It took me a long time to remember that I had had non-Hodgkin's. As soon as I told them that, that's when they discovered it had come back. And then it came back again in 2018. This particular type of lymphoma, it might never come back, but if it comes back once, then it tends to come back a lot. So I was surprised when it came back a third time, but my doctor wasn't.
Safe to say, Rapkin is somewhat of an expert when it comes to being a cancer patient, and she's willing to share everything she's learned. Her new book, Cancer Sucks, But You'll Get Through It, is a complete guide from detection to remission and beyond. Rapkin says spreading this knowledge is important because she knows how one wrong decision can derail your entire care plan.
I was in such a fog. I just did what anyone told me the first time round. But I got smarter during that process. And by the time I was done with that process, I had had this wonderful realization that I'm not powerless. I'm not supposed to just do what everyone tells me. I was actually named CEO of a major health concern, which is mine. And so I started learning how to be a good CEO. And that really helped me during my second time. And it helped me even more during my third time. To be honest with you, it was only because of that that I was able to avoid a surgical procedure that was not necessary, had nothing to do with my cancer, and would have forced me to delay chemo by maybe a year. That could have cost me my life.
During a hospital stay, Rapkin had been woken up early by a urologist who was insisting that she needed kidney surgery. It was a shock since she was there for her cancer, not a kidney issue. But this doctor was in a hurry and needed Rapkin to choose which surgery she preferred instead of taking time to consult her oncologist.
She was so insistent, and she looked very official in her coat. And I was like still blurry-eyed wearing this hospital gown made of nothing. And I kept saying, like, to myself, I said, be strong, Michelle. You're the CEO. You don't have to say yes. Say what you need to say. And I had to really, it was the first time in my life I ever heard myself urging me to do something. And that choice to get my oncologist's opinion, which she did not want to wait for, she said, this is about kidneys, that impacted my whole future.
In the end, Rapkin's oncologist told her to wait on the surgery until after she started chemotherapy to see if the issue would resolve itself. She later found out that the option she was almost pushed into would have delayed her chemotherapy for a year. Rapkin says this experience of standing up for herself and being her best advocate was a huge mental shift.
I have the most to gain and the most to lose. So I need to make the best decision I can make at the moment, whether it's that it's time for my friend to leave or that I'm not really comfortable with this procedure. Could you explain more to me about why we need to do this and what the options are?
And just like Rapkin, hundreds of thousands of other people are going through the same experience. But in the process of trying to figure out their cancer diagnosis and treatment options, they're often blindsided by the challenges no one warned them about. For example, Rapkin was shocked to learn that scheduling a dentist appointment was a high priority before she started chemo.
Doctors are busy getting you better from cancer, so they're not thinking about these things. Dentists aren't going to tell all of their patients, if you ever have cancer, come first. But once you're in chemo, you cannot afford to have your gums prodded and poked and start bleeding because of germs. If you get sick during chemo, you have to stop the chemo because your immune system is so weak. And so you're supposed to go get a thorough tooth cleaning before you go to start chemo so that if you have cavities, you get them filled, whatever. Because once you start chemo, it's going to be a year before you can go to the dentist.
Other tips like don't use commercial mouthwash and drink extra water during chemo sessions are secrets unless you're a veteran cancer patient. And even well-known stuff like hair loss comes with its own surprises. Thankfully, Rapkin's friend Abby was able to ease her mind about a common worry.
She said to me, Michelle, your hair's going to fall out about 10 days. And not long after, you're going to get scared that you're getting sick because your nose is going to start running uncontrollably. And you're going to think you have a cold, have to stop chemo, go to the doctor. I'm here to tell you that when you lose your hair, you lose all the hair in your body, including the hair inside your nose, which is to filter normal sinus drops that come down from your sinus. So she said, so when your nose starts running, don't worry, just carry Kleenex.
That was the final conversation that pushed Rapkin to go public with the insider tips and tricks of being a cancer patient. Newbies probably don't know the credible websites to research their new diagnosis, or what types of doctors will make up their care team, or that wigs are a tax write-off. And just like how Rapkin documented all of this, she urges patients to follow her lead and take note of every part of their journey, literally.
It is a lot of work. And that's actually one of the reasons that, if you have a partner or a close friend or someone who you can delegate a lot of that work to, that's a great thing. Not always possible. But one thing that was not a lot of work that was probably one of the most valuable tools was just my little physical notebook that I just kept with me. And I kept on my bedside at night. And I wrote down everything. I wrote down websites, phone numbers, questions. I had a running list of questions for different doctors.
She'd track her daily symptoms and always know that this little notebook had all the information. For more important documents like medical records and insurance bills, she'd organize them in boxes. But since that kind of effort isn't always going to be possible, Rapkin figured out a solution that kept her records on track, even on her off days.
I would just stick any piece of paper in a box if I wasn't feeling well and go through the box later. Just put everything in one place because really this is a long journey. And so you are going to have to refer back to things, whether it's for reimbursements or information or deductions or all kinds of things.
But having to keep track of your bills, treatment plans, and insurance claims on top of dealing with a life-threatening illness can seem impossible at times. Some days it may feel like you're doing everything in your power just to keep your head above water. No matter how on top of things you are, cancer is scary. It can be hard to stop your mind from wandering down dark paths. But Rapkin says you don't have to mask these very valid feelings with fake optimism.
I can be a worrier too. And there's plenty to worry about when you're going through cancer. And finally, I was getting so overwhelmed with fear that it occurred to me, I'm just like wasting time and energy, and I'm feeling worse and worse every moment. What can I do today that is going to be useful in addressing this anxiety? Something concrete. What phone call can I make? What note can I write? Whatever. And then do it, I told myself. And then let's meet again at 9:00 tomorrow morning and have a worry appointment. So for the rest of the day, once you've done the things that you can do, if a worry creeps up, table it for your 9:00 appointment the next morning. And does it work always? No, but you'd be surprised how much it does work.
Giving herself a 10-minute window the next morning to address her fears and anxiety allowed Rapkin to honor her emotions without feeling like they were burying her alive. Though 3 cancer diagnoses are no one's idea of a good time, Rapkin grew smarter and stronger with each one. She realized the value of choosing to put herself first, a decision that extended to how she viewed her doctors. It can be easy to accept that doctors are always right, especially when the topic is so far out of our own expertise. But Rapkin argues at the end of the day, doctors work for you. You need to make sure that your best interests, both mentally and physically, are the main priorities.
I say early on, when you're interviewing oncologists, ask yourself, does that oncologist treat me the way I expect him or her to treat her spouse or parent? Sometimes people can be so into their own issues, even doctors who have an appointment with you, that you get sort of shoved off to the side. And yes, they know what they're doing and they're probably going to do a good job, but you walk out of that appointment feeling defeated.
When you already have a disease that is taking such a toll on your mind and body, is it worth having a physician that's going to add to that stress? Rapkin's book isn't just a guide on how to maneuver a cancer diagnosis. It's a tool to help patients build the confidence and knowledge to be their own best advocate in any situation. Cancer Sucks, But You'll Get Through It is available now wherever books are sold. You can find more information about Michelle Rapkin and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.
Coming up next week on Radio Health Journal.
We used to put athletes kind of in cocoon therapy, right? We would have an injury, we would put them in a dark room and turn off lights and no access to computers or TVs or phones or any of that sort of thing. And we found out that that's really bad.
The major changes in concussion guidelines.
But first, how understaffed preschools are affecting the economy.
We're seeing women in particular, but all parents who are unable to go back into the workforce because they cannot find childcare for their kids.
All that and more on Radio Health Journal.
I'm Greg Johnson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
For the first time, they feel community. They feel like they belong somewhere. And belonging changes everything.
Helping unhoused teens one child at a time. Then,
I think it is one of the most valuable and underrated things that you can get into.
Reaping the many benefits of growing your own produce. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints Radio on Apple Podcasts, Spotify, or wherever you listen to podcasts. Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website, radiohealthjournal.org, or wherever you listen to podcasts. Follow us on Instagram, Facebook, and X for daily content. And tune in next week for another edition of Radio Health Journal.
What if you could have a career where the opportunities are as vast as our nation, where it's not about mission statements, but a shared mission? At U.S. Customs and Border Protection, we go beyond to protect more than borders, from ship to shore, air to ground. Cities to local communities, CBP agents and officers are keeping people safe. Join U.S. Customs and Border Protection and go beyond for something far greater than yourself. Learn more at cbp.gov/careers.